Welcome back to the Thursday edition of City News. Our resident GP is with us once again, Dr. Cate Mills. Welcome.
Hi, Steve.
Talking about thyroid this week. A lot of people seem to have the problem.
Yes, it is quite common.
So I think we should find out firstly, where is it, what is it, what does it do?
So your thyroid is a gland and it's situated in your neck, and it's quite a small gland. It's probably maybe weighs about 30 grams and it's a butterfly shape sitting in your neck. And it's a gland where it makes a hormone, and a hormone is kind of like a messenger. It's something that travels from the place where it's made to other parts of the body to exert its effect elsewhere. And this hormone, called T3 and T4, are made by the gland, and they go out and they help control the body's metabolic rate. So they control the rate that our cells burn fuel to create energy for us.
So you're talking metabolism?
Metabolism,
Okay.
your body metabolism, exactly.
So what happens if it goes wrong?
So if you have too much of these hormones that it makes, then the body's metabolism speeds up, and too little, then it slows down. And you get different symptoms. If it speeds up, you might notice that you get you feel anxious, or you sweat, or you get palpitations, all signs that the body is, you know, going a bit faster than it should.
Working a bit overtime.
Your blood pressure might go up. Yeah, you might have trouble sleeping or getting yourself to sleep. Yeah.
And then the other side of it?
And the other side is kind of the opposite. The body will often cool down. So you might feel cold, you get constipated, you can get depressed from having not enough thyroid, and things just kind of, slow down in terms of, don't work as fast. So your thinking is slowed, you might have trouble concentrating and remembering things.
So how, I mean, as a GP, I mean, is it something that's quite hard to diagnose? Because the symptoms that you're telling me are
they're subtle.
Everyday kind of,
but the list of them is quite long. So it's often something that we're screening for. If people come in with something that's non-specific, like we can't quite pinpoint what it is, it's often a test that we'll check, just as a way of checking, is your body functioning at the right rate? Is its metabolism working as it should be?
And is everybody's the same?
Pretty much. Pretty much. The levels in the blood are quite consistent, and we measure something called your thyroid stimulating hormone, which is made in a small gland, another gland in the brain called your pituitary gland, and it travels down to the thyroid gland and stimulates the thyroid gland to make T3 and T4, the thyroxine hormones that do their job in the body. So what we measure is that thyroid stimulating hormone, because if the hormones aren't working well in the body, if the body's saying, I haven't got enough of these, then it'll send your thyroid stimulating hormone up. And if you've got too much of your T3 and T4 hormones, then that thyroid stimulating hormone goes down, because it tells the brain, oh, you've got too much of this, you don't need to make the messenger that tells the gland to work.
Quite complex, isn't it?
It's even more complex. There are even more layers on top of that, and something else stimulating another part of the brain to do its job. So it is quite a complicated process to actually produce it, and sort of fine-tuning.
So I mean, is it an incredibly important part of the body? I mean, can we do without it? No,
we couldn't survive without it. And so in the olden days, when people had a goiter, that was your thyroid gland. That was the thyroid gland getting really, really enlarged, and the commonest cause of that in the past was an iodine deficiency. So if you didn't get enough iodine, which you need to make those thyroid hormones, then the gland would try to work even harder, trying to make this hormone very unsuccessfully, because it didn't have all the components, and the gland would get bigger and bigger. And you may have seen pictures from the past of people with these enormous neck swellings that we don't see very much anymore. But very occasionally we will see a gland that's enlarged, and you'll notice a little bit of fullness in somebody's neck from it.
So where do we get our iodine from?
Well, in our environment it's quite low in terms of in our soil and in our food chain. So it's supplemented in our salt mainly, and that made a tremendous difference to people with goiter, just putting it into salt. Of course now people eat less salt, and a lot of the salt that people choose to use is natural sea salts that may not have iodine added to it. So we have more recently seen people with iodine deficiency again, because they're not getting it from the higher salt intakes that we've had in the past. Yes.
So, treatment-wise?
If it's underactive, it's very easy to treat because we simply give you a synthetic form of those hormones in a tablet every day. It's quite important that we monitor exactly how much of that you need, and there's a little bit of trial and error first off to work out exactly how much each person needs. But that would be monitored by usually a blood test sort of 4 to 6 weeks after you've started on treatment, and then an adjustment of the dose to make sure you're getting the right amount. And that can change over time, so as you get older you may need more or even less of it, so it's important to have a regular blood test to check that you're on the right amount. If you've got too much thyroxine in your body, if the gland is making too much hormone, then there are lots of different ways of treating that. Again, it can be treated with a medication, it kind of blocks the effect of it. We sometimes use surgical methods, cutting out part of the gland, and various sort of radioiodine treatments as well to kind of destroy or inactivate part of the gland as well. It's a little bit more complicated.
And what's more common?
Hypothyroidism is more common, so an underactive thyroid. People with overactive thyroid we don't see very often, but often they're quite sick when we see them. And sometimes they have a really unusual eye disorder called Graves' disease, where their eyes kind of look quite bulging and their eyelids are quite retracted, and you usually remark on somebody that's got this because their eyes look unusual. And if they've had it for a while, then sometimes even when you fix the problem, their eye changes stay the same.
If in doubt, go and see your GP.
Absolutely.
Constipation?
Yes.
Next time.
Yeah, absolutely.
Lovely. Important subject. Dr. Cate Mills, thank you for coming in.
Welcome.
After the break, we review some DVDs, some more goodies actually. Another one to give away as well ahead of the weekend with Layla from Movie Time in Ngātaha.